Hi Jackie, how are you today?
Good, thanks.
That's good. Well, we're really excited that you're coming to do some training, and there's just a few things we need to ask you before we get started. And
Sure.
It's just a bit of paperwork to make sure that you're all clear and ready to go, and there's no existing injuries or any medical conditions that we need to know about.
Okay.
Because if there is, we want to make sure that you're got clearance from a doctor and everything's all good to go. So we're just going to complete the adult pre-screening tool. Basically, the aim of this is to identify those individuals with known disease or signs or symptoms of disease who may be at a higher risk of an adverse event happening during their physical activity or exercise. So I'm just going to ask you these questions, and you just need to answer yes or no.
Okay.
And then we can move through to the next section. So has your doctor ever told you that you have a heart condition or have suffered from a stroke?
No.
No. Do you experience unexplained chest pains during physical activity or exercise? No. Good. Have you ever felt faint or have dizzy spells during physical activity or exercise that can cause a loss of balance?
No.
No. Good. And do you have asthma or have you had an asthma attack in the last 12
No.
months? No. Okay. If you have diabetes, type 1 or 2, have you had any trouble controlling your blood glucose in the last 3 months?
I don't have diabetes.
Well, that's good. And do you have any diagnosed muscle, bone or joint problems that could be worsened by participating in exercise? No. Good. And do you have any other medical conditions that may be dangerous for you to participate in physical activity or exercise?
No.
That's great. So you've answered no to all of those, which means we don't have to get any referrals from doctors or anything for you to start training. So that's great. We can go through to the next stage. So obviously you're a female.
Yep.
Your date of birth?
The 6th of the 2nd, 1982.
82, fantastic. So
30.
35?
I'm 35, yeah.
Let me do the maths.
Yeah.
Great, so that's fine. That's no risk factor there. So has your family had a history of heart disease, such as stroke or a heart attack or anything like that?
Yeah, my dad did have a heart attack.
And how old was he?
He was 70.
70, okay. So that does add a risk for you.
Okay.
So it's in your family. It's something we've got to be aware of.
Sure.
Do you smoke cigarettes on a daily or weekly basis, or have you quit smoking in the last 6 months?
Yeah, I did quit 4 months ago.
4 months. Well, that's great that you quit.
Yeah.
That's great. But it still is not at that 6 month mark. So we do have to put that down as a risk.
Okay.
But that's fine. In a few months' time, that won't be there.
Exactly.
So describe your current physical exercise or activity level. So would you say light, moderate, vigorous?
Probably moderate.
Moderate, yeah. And how many times a week would you be doing that?
5 times a week.
5? Well, that's fantastic. And how long would you be doing that for?
60 minutes.
60 minutes. Wow, that's really good. So because you've done way over 150 minutes a week, that's actually a -1 for you for your exercise. So that's great. That brings your risk down a bit.
Okay.
Now, how tall are you?
165.
165. And your current weight?
67 kilo.
67. Fantastic. Well, that gives you a BMI of 24, which is under 30. So that's great. Do you have any high blood pressure that you know of? No. And have you ever been told you have high cholesterol?
No.
No. And have you ever been told you have a high blood sugar level?
No.
No. Great. So overall, we're just at +1 here. So that's all right. That's all good. Nothing major.
Okay.
Have you ever spent time in hospital in the or for a medical condition, illness or injury in the last 12 months?
No.
No. And are you taking any prescribed medication at the moment for those conditions?
No.
No medical conditions? No. And are you pregnant or have you given birth in the last 12 months?
No.
No. Do you have any muscle, bone or joint pains or soreness that is made worse by participating in activities, particular activities? No. Okay, great. So moving down here. So overall, we're just at that +1. Okay. So that's great. So your risk factor is low. So we've got low, moderate and high. So you're in the low risk factor of clients. So that means that individuals in this low risk factor may participate in aerobic exercise and it may be vigorous or high intensity. So that's great. We can get you going.
Okay.
If we have a look over at the exercise intensity guideline, you're sitting here. So you're in between that vigorous and high section, which is really good. So we can really get your heart rate going. So we can be at 90% of your maximum heart rate. And we can be at 7 or greater for your rate of perceived exertion.
Okay.
Yeah, so it means we can really, really get you going.
All right. Awesome.
So let's
I
get
look forward to getting started.
Yeah, it's exciting, isn't it?
Thanks, Sally.
Thanks,
Thank
Jackie.
you.